Yeah, I'll be your nursing student today. Can I get your name and date of birth?
Joe Smith, 10/10/53.
Okay, I'm providing proper hand hygiene. I'm gonna go ahead and check your wristband, and that matches. Do you have any allergies?
Nope.
All right. So it looks like we're gonna place an NG tube today and get hooked up to suction. And I've brought all my supplies. Have you had an NG tube before?
No.
Okay. Have you had any trauma to your nose?
No.
Okay. Just looking at your nose, I see that your septum is midline and is not deviated. I don't see anything, any obstructions or any notable deformities. There we go. Sorry, that kind of distracted me, not gonna lie. I'm gonna sit you up in high Fowler's position because that is the position we need to be in for this skill. And if you don't have a preference, because you've never had one before, if we do it on the right side, is that okay?
Yes.
Okay, I need to take out the pillow from behind your neck, so I'm gonna do that. You need to make sure your bed's locked before we go. Okay, I'm gonna place this linen saver right here for any gastric secretions that might come up. I'm also gonna go ahead and give you a kidney basin for that same reason. A tissue if your eyes start to water at all. You need to wipe your mouth, and water to help get the tube down later. All right, so I'm gonna get some tape ready. Check for a presence of a gag reflex. Okay. And now I'm going to check for patency of your nose. So I'm going to have you go through your right and through your left, and they are both patent. And I already checked for that gag reflex. Now I'm going to go ahead and measure the tubing we're going to use from the tip of your nose to your earlobe down to your xiphoid process. And I'm going to go ahead and mark that measurement with tape, so I know where to insert to. Okay, and I'm gonna warm up this tubing either in my hands or with warm water prior to putting the tube in. And then I have water-based lubricant that I'm gonna use here because that is absorbed by the body here. Okay, and then I am gonna go ahead and start to insert. If you start to gag, I'm gonna go ahead and have you sit up and drink some water, okay? So we're gonna start. And so I'm gonna sit him up and have him drink some water. We can continue to drink as I advance the tubing. Now for the purposes of this skill, I know I need to insert the tubing until it gets to the nose to this tape point, but I cannot due to the mannequin is kind of fighting with me a little bit. Okay, so I'm going to attach the tubing to his gown with a safety pin. And I'm also going to attach the tubing to his nose with a piece of pants tape. I will loop up and around. Okay, and then to check placement, I would either do an x-ray or I can check with gastric contents. So I'm gonna go ahead and clamp here, and these two don't physically connect, but I would connect and then unclamp, get about 15 milliliters of gastric contents, clamp, and take off. And then I would hook up to suction, intermittent suction. Turn that on, and then I have a pH strip in here, so I go ahead and put those gastric contents on that pH strip, and a normal pH is between 1 and 5.5, and his pH is 3.5, which is normal. Alright, so then I would lower his bed, make sure he's all comfortable, ready to go, and yep, and then I come back a few days later, I said, hey, time to get your NG out, so I'm going to bring up his bed again and bring him up to high Fowler's position. And prior to discontinuing the tube, I would unhook it from suction and take 15 milliliters of either air or sterile water and connect to my NG here and instill it to clear the tube of any possible gastric contents. Unhook, and then I would also disconnect his tubing from his gown here. And from his nose. And now, Joe, before I pull it out, I'm going to have you take a big deep breath and hold it. I'm going to pull out and wrap it up in between my gloves here and discard properly. And if there's nothing else I can do, I can make sure his bed is down and locked and he is stable and